So my son, he was born when I was 20 years old, so he had some difficulties. And then he had to go to Augusta, Georgia. He had a kidney transplant at 1.5. But during that time, I learned a lot about healthcare. I learned a lot about seeing people help my son, and it just made me want to give back in that type of way. Well, my cousin, she was a respiratory therapist, and I started talking to her about the medical field. And I eventually got into medicine, starting with respiratory therapy. As time went on, and my son had different battles with health. I realized that I wanted to give back in a little bit more of a capacity, so I went back to PA school. I grew up in rural Southwest Georgia, a little small town called Newton, Georgia. If you went to Panama City, you probably went through it. But I grew up on the farm. Day off, I am most likely going to sit under my garage, have a nice warm cup of coffee, start my day. Then after that, if I got some free time, I'm probably gonna find time to do some fishing. And I don't really have to catch anything. It's more relaxation for me to be in the outdoors, hunting, fishing. Those are the things I'm gonna do for my pastime, to really just relax and enjoy that day. Going through clinicals, there's a lot of times where patients always have said, "No one listens to me." That never left me, but I think me taking that extra minute to really listen, and also when I'm looking at my patient, I try to think about my family member sitting there and what I would want my outcome for my family member to be. So those factors right there keep me in that space where I am able to process that and not get, if I hate to use this term, in a hurry to try to resolve an issue. Well, in this area, I'm dealing with the same people. So there were struggles that I saw on the farm with people that was working on the farm. My struggles on the farm, it helps me better understand this community, so I can relate to a lot of their situations, a lot of their issues that may complicate health for them. The ultimate goal for me when I became a PA, even as a respiratory therapist, but when I became a PA, is to do my job as efficient as I can and to save as many lives as I can. And there's no amount of money that would take the place of that feeling.